Chandigarh, works as a tutor in the Department of Pathology in his alma mater. He is a proud recipient of the first ICMLS Young Scientist Award in 2017. He has more than 12 publications in national and international journals and has won many significant awards. Welcome, sir. Looking forward to your presentation.
On quality management, professional education, and recent regulatory and policy developments in MLS. To share with us about NCHP Act 2021, progress, challenges, key issues, and way forward, I invite the President of ICMLS, Dr. Kaptan Singh Sherawat, onto the stage. To accompany him on the stage, I welcome Dr. Pankaj Kaur, Mr. Ramesh Dahar, and Mr. Nilyan Tari. Please join us on the dais, sir.
CHP to give us a complete picture. I now invite Dr. T. Salvia Devi to share her views on the future prospects of medical laboratory science in academic and research.
That was a great presentation. Your talk was particularly interesting. Thank you, ma'am. Thank you, Dr. Pankaj, Mr. Ramesh Dahar, and Mr. Nilyan Tari for staying with us through the session. That brings us to the end of the morning sessions. As we take a much needed break for lunch, a small mention that we'll be reconvening for the afternoon sessions at 2:40 p.m. Happy lunching, everyone.
And Sujata Rajesh will accompany you through the subsequent sessions. After the auspicious and inspiring inaugural session, where we were reminded of the importance of collaboration and the pursuit of knowledge, we are honored to continue today's proceedings and lead us into the heart of our conference.
The session ahead promises to offer a fascinating range of insights and discussions. Whether you're here to learn about the latest advances in our field, share your own discoveries, or connect with fellow researchers, today's session has something for everyone. We are fortunate to have a distinguished panel of speakers who will share their expertise. Each of the papers and presentations we will hear today represents not only the hard work and dedication of the researchers involved, but also the collective advancement of knowledge in our field.
We encourage all of you to engage, ask questions, and connect with one another throughout these sessions. This conference is a great opportunity to forge those connections, to push the boundaries of what we know, and to spark new ideas for future research. As we move into today's session, let's remember that it's the curiosity, creativity, and critical thinking of researchers like you that drive our collective progress. So, whether you're here to gain new insights or challenge exciting ones, we urge you to be engaged and inspired by the incredible presentations that will unfold before us.
We start our first plenary session on molecular technologies and AI, next frontier in clinical laboratory diagnostics. Without further ado, I'll now hand over to our first speaker, Dr. Malkit Singh, who will talk about the role of artificial intelligence in medical laboratory sciences. I have no doubt that the presentation will provide us with a thought-provoking start to what promises to be an intellectually stimulating session. We also invite onto the stage Dr. Tirumurugan and Dr. Uttaravel to accompany Dr. Malkit Singh on the stage. At Dolphin University, and he is actively involved in Board of Studies and National Expert Task Force. A former lecturer from PGIMR Chandigarh, Sir is an active executive member in key medical laboratory associations. Sir has more than 25 publications in national and international journals. Handing over to you, sir.
Good morning, everyone. Our today's first talk, role of artificial intelligence in medical laboratory science. It's a very, very important talk. But I've seen many people, particularly youngsters, they are afraid of, they have the fear that the computers will replace them. That the computers will replace that. It's not like that. When I was a student in 1981, we learned many manual techniques. We used to take the sample, manual transportation, manual processing, ground stain, Wheelerson stain, everything was manual. It was very, very difficult. But to know basics are very, very important. Even if you are performing some computer-driven technique, even then you have to learn the basics. You will be successful if you know the basics. So at that time, the processing of samples was mainly dependent on manual microscopy and colorimetric assays. But today, we have fully automated analyzers and digital technologies. And now, we are looking at the dawn of a new era, that is era of artificial intelligence, where machines not just assist us, but are learning, predicting, and helping us to make directions. Artificial intelligence refers to any type of computerized system capable of performing complex tasks that historically only humans could do. Like if you want to diagnose tuberculosis from sputum sample in a laboratory, you have to stain the sample manually, then you need to evaluate it manually. And I know when RNTCP was guiding us with WHO recommended techniques that you have to see at least 100 fields in a microscope, that used to spend 15 minutes for one sample. If there are 20 samples, then how many times you need to evaluate? And at that time, many people just were skipping. I have seen in one place where when I evaluated one slide, it was 3+ positive for mycobacterial tuberculosis. But those people reported it 1+ positive only. So that is a variation, human to human variation, which now has been reduced. Now computers, AI can do such as reasoning, problem solving, visual perceptions, speech recognition, decision making, and translation between languages, etc. AI work through these basically. So AI works through machine learning, deep learning, and natural language processing. Machine learning, the algorithms learn from past data to make corrections. To the AI software, we submit the past data. In the last 10 years, this happened. And after analyzing that data, the AI softwares, they predict what is going to be in future. Deep learning means developing neural network that mimic the human brain for complex image and pattern analysis. It is very, very difficult to analyze an image under the microscope, but AI has made it so easy. Natural language processing helps interpret clinical notes and laboratory reporting. As we are not computer persons, I will not go into this detail. I will talk on the key areas where AI is transforming medical laboratory science. First is diagnostic automation and digital microscope. When we were students, everything was manual. Then later, we found that there are some semi-automated systems, automatic staining that was coming. But now, above automatic system, AI is there. AI helps us even interpreting. Traditionally, microscope-based diagnostics like blood smear examination, urine sediment analysis, and histopathology, they depend heavily on human observation and expertise. AI-driven digital microscopy now automates many of these functions. In hematology, AI-integrated digital cell counters are able to identify WBCs, red blood corpuscles, their morphology, and platelet abnormalities automatically. We need not to think it will give report to us about the abnormal platelets, abnormal WBCs, abnormal red blood cells. In example, I can tell you that AI models such as Vision or Scopius systems use AI to analyze peripheral blood smears and accuracy comparable to an expert hematologist. So it means there is no need of a hematologist. It's not like that there is no need of hematologists. Hematologists are required day-to-day updating of AI systems. Because the computer has been made by humans. Humans can replace computers, but computers can never replace humans. So इसमें डरने की कोई भी बात नहीं है. Histopathology The whole slide imaging combined with AI algorithms can detect malignant changes, can grade tumors, and highlight regions of interest for the pathologists. For example, metastatic cancer cells in lymph node can be detected with a sensitivity exceeding 99%. Means if a pathologist gives some report, up to 99% specific report can be generated by AI system on that slide without the histopathologist. Now, this is a slide with a smear. Left side, you can say normal smear to be analyzed by a pathologist, and the other side is the Google's Lina image by the Google software, Google's Lina. The smear is analyzed. All the red spots in this are malignant cells in the lymph nodes. In parasitology, AI-driven microscopes are used to detect malarial and other blood parasites in blood films, intestinal parasites from stool smears, which is very much particular to be useful in remote or resource-limited settings. The system can be taken in a vehicle to the rural areas even without a pathologist, without a parasitologist. In clinical chemistry and immunoassays, automation is already very active. Do you know, I have seen first automated biochemistry analyzer 20 years back. I have seen, I got access to that, but that system came into the Department of Biochemistry in 1985. In 1985, we got automated biochemistry analyzer. AI system analyzes complex biochemical data to identify abnormal patterns or trends that may be missed by the human eyes. Our human eyes can miss, but AI don't miss that data. AI algorithms can predict acute kidney injury or sepsis 24 to 48 hours before clinical symptoms. 24 to 48 hours before clinical symptoms appear, AI can tell you that there may be acute kidney injury or sepsis. AI continues monitoring quality control data. Now, we put the quality control with every batch. But when the machine is running, AI is monitoring quality control system regularly at all the times. It can detect instrument drift or reagent degradation in real time, preventing erroneous reporting. Automatic generation of clinical correlation notes is a wonderful thing. These days, it is not just that automated machines are working, but those machines, those can give you the clinical correlation notes even. Some laboratories are using AI-driven interpretive commenting system that automatically generate clinical correlation notes for common profiles such as lipid or liver function tests. Microbiology and molecular diagnostics are not behind. There also, when about 40 years back I was a student, we used to take approximately 72 hours to 4 to 6 weeks for identification of various organisms. Some rapid growers, they were identified in 72 hours, and organisms like Mycobacterium tuberculosis, they used to take approximately 4 to 6 weeks. Rather, if antibiotic susceptibility was required, another 4 to 6 weeks are required. At that time, the work was very much laborious, but at this time, even culture plate reading is very simple. AI tools like Vector AI and clever culture analyzes the images of agar plates to identify colony morphology and color patterns. Where when the humans analyze these culture plates, they may miss some colony. They may miss some particular morphology of the pathogens. They can even suggest likely bacterial species or contamination. So even just looking at the plate, the AI system can tell you that probably this organism is there. Beckman-Coulter DXL microscan system uses AI to identify antibiotic resistance patterns. Microbial identification. As I told you, 4 decades back, identification was being done by the phenotypic characteristics, those are biochemicals, etc. Putting biochemical for 10, suppose 10 pathogens you have identified, putting biochemicals for 10 samples, 10 strains was very, very difficult. Whole day was required for that. But these days, just by using Malditov, which came into our department 10 years back, it takes only 45 minutes for 46 strain identifications. And the cost was, when I retired, at that time the cost of consumables required was just 10 rupees per strain, just 10 rupees per strain, but the equipment is very, very costly. At that time the equipment was costing 1 crore, and I think nowadays it is 2 crore rupees. After spending 2 crore rupees, you can identify the organisms up to international level. Nobody can reject that report. International level report you can generate just in 10 rupees consumables. AI integrated Malditov identifies bacteria and fungi in minutes. In PCR and molecular data interpretation, AI assists in reading real-time curves, reducing false positive and negative results and optimizing primer designs. For example, during the COVID-19 pandemic, AI tools helped interpret millions of RT-PCR results, managing genomic data and track emerging variants globally. In genomics, deep learning models analyze genomic sequence to detect mutations. Now we can detect even mutations with diseases such as cystic fibrosis and hereditary cancers. AI aids in variant classification, improving speed and accuracy of general testing. It is not only identifying the organisms or doing this staining, etc., but it is doing much beyond that. The workflow optimization and laboratory management these days is not dependent on the AI systems. Beyond diagnostics, AI enhances operational efficiency within laboratories. Sample routing and prioritization. AI-based laboratory information system automatically route urgent samples like detection of troponin in heart muscle damage for faster processing. If the automatic sample routing system is there, AI-based, then the samples will be distributed just on the priority basis. Then predictive maintenance. When the equipment needs maintenance, it will tell you just 10-15 days earlier, so that you can prepare yourself for the preventive service. Then it controls inventory and reagent management. It will tell you that when your reagent is going to be finished, in how much time you need to purchase the chemicals. Then data integrity and error detection. Smart algorithms detect mismanaged barcode. Sometimes even barcodes. We are nowadays dependent on barcodes after receiving samples. Now even barcodes may mismatch. So artificial intelligence system that detects mismatched barcodes, inconsistent results, or transcript errors, ensuring reliable reporting. Then personalized and predictive medicine. Perhaps the most exciting feature is in AI is AI-enabled precision medicine. AI integrates the laboratory data, with patient demography, clinical history, imaging and genomics to provide personalized risk profiles and predictive insights. So these days AI even tell you that very soon you are going to suffer heart problem, very soon you are going to suffer diabetes. Predicting cardiovascular problems from lipid trends and inflammatory markers is one of the examples. AI models combine HbA1c and genetic data to forecast diabetes onset. In oncology, AI correlates tumor markers, molecular data, and histopathology to recommend personalized treatment plans. There are so many benefits of AI integration. Accuracy and precision has increased. The speed and efficiency. Our population is growing, health systems are growing, there's a big rush in almost every hospital. There you need fastness with efficiency. So AI help there. Cost effectiveness also. It optimizes reagent uses and reduce wastages through predictive analytics. Quality assurance, continuous monitoring ensures compliance with accreditation standards like NABL, CAP, etc. It enhances clinical correlation. AI can assist clinicians by generating interpretive suggestions or probability-based diagnostic reports. Accessibility in remote area is now easy. The AI integrated systems can be taken into a van to the remote areas and then you can study. No pathologist is required, no microbiologist is required there to report. But there are so many benefits and those there are challenges also. First challenge is AI adoption. People are not ready to adopt AI systems. We have one question, which I just told you in the start, that many people think that if we adopt AI, we will be removed from the job. We are not required for that. Everything will be done by AI. The problem is data privacy. AI system is an electronic system. Data can be hacked. A logarithm bias, if the AI is trained on data from a specific population, like from Indian populations, from African population. So the data, data is fixed. Humans can think that this is Africa, this is India, this is America, but computer will talk only what we have fed to it. So there may be a biasness. Then validation and regulation, AI tools must undergo clinical validation and regulatory approvals before integration. Interpretability is also a little bit problem right now. Complex black box models may provide results without transparent reasoning. This limits trust among the professionals. Workforce transformation. Laboratory personnel must be trained in AI literacy, data analytics and informatics to effectively collaborate with AI systems. But a little about what is future. Far from replacing humans, AI is reshaping the professional identity of the laboratory scientists. It is not that we will be removed, but our training will be revised. The modern laboratory professional is evolving from being a data generator to a data interpreter and healthcare information. Future competence includes understanding AI system, output and validation principles, ensuring ethical responsibility data for data use, integrating laboratory data with clinical and genomic information, continuing learning and adoption to encouraging to the emerging technologies. We have to. You are here to learn more. Now in future, you will go to other conference or workshop. But many people, they don't go to workshop, they don't go to refresher courses, they don't update their knowledge, then they will definitely they will be left behind. The focus will shift from how to perform a test to the focus will shift from Our today's focus is how to perform a test, but it will shift to how to interpret and apply data intelligently for better patient outcomes. There are global contributions. Among the global perspectives, Roche Diagnostics, Siemens Healthcare, Path AI and AIIMS Medical Analytics are working on future AI systems. In India, ThyroCare, SRL Diagnostics and Metropols use AI for quality control and efficiency improvement. AIIMS Delhi and IIT collaborations are developing AI models for blood cell classification and tuberculosis screening. Then under Digital India and National Digital Health Mission, AI-enabled laboratory networks will connect rural and urban healthcare systems. So concluding my talk, I'll say that artificial intelligence is creating laboratories that not only test but also think and predict. The promise of AI lies in collaboration between human expertise and machine intelligence. The laboratories of the future will be a hybrid where human compassion, ethical judgment, and scientific reasoning harmonize with computational power to achieve the ultimate goal. That goal is better patient outcome. Again, I will come on the same question. Will it replace the MLS professions? The AI will not replace medical laboratory professionals. This the students particularly. You understand this? AI will not replace medical laboratory professionals. But those who adopt AI will replace those who do not. जो AI के साथ अपने आप को इंटीग्रेटेड रखेंगे, अपनी नॉलेज को AI के साथ जोड़ के आगे बढ़ाएंगे, वही रहेंगे. और जो सोचेंगे कि यार क्या लेना है इसे, अब हम जॉब तो मिल गई, ऐसे चलती रहेगी, वो पीछे रह जाएंगे. और फिर कहेंगे कंप्यूटर्स ने हमें रिप्लेस कर दिया. तो कंप्यूटर्स रिप्लेस नहीं करेंगे, लेकिन आपको AI के बारे में सोचना है, पढ़ना है, अपने नॉलेज को अपडेट करना है. थैंक यू वेरी मच.
Thank you, sir. That was a very insightful, impressive and informative session that we had from you. You really touched upon, you took us to the journey of manual diagnostics to automation and now into an era of AI, and also touched upon every area of laboratory science where AI is playing a role and will play a role. And also you talked about the challenges, and it was very nice to note that, because I thought that would be a question from me, but you ended your session with the answer itself, where every new technology that comes up will find some resistance at first. The first thing is it seems to cut down on the manpower, human resources, but as you rightly said, it's only going to augment and not take away the jobs from the professionals, and rightly so, because we have a large group of students here to stress upon the need for us to update ourselves with AI, otherwise we're going to be left behind. So that was a really nice session and the need of the hour, and in tune with the vision of this conference. Thank you so much, sir. It is open for questions.
The question which I have set at the end, that is the main question every student, every medical technologist is having. If you have any other questions, you may ask even after the session. I am here whole day. You can discuss with me. But at the end I will say again, please adopt AI, update yourself with AI machines. You will be in progress. You will stay with God's grace up in your profession. Your work will be recognized. Thank you very much.
Thank you, sir.
Thank you, sir. For the next session, I call upon Dr. Ashwin Raina to enlighten us about Revolutionizing Pathology, the Power of NGS and AI in Precision Medicine. Chandigarh, works as a tutor in the Department of Pathology in his alma mater. He is a proud recipient of the first Icmls Young Scientist Award in 2017. He has more than 12 publications in national and international journals and has won many significant awards. Welcome, sir. Looking forward to your presentation.
Thank you. Good afternoon, everyone. So the topic for second lecture for today is revolutionizing pathology, the power of NGS and AI in precision medicine. So as already talked in the earlier session that AI is involved in each and every field of science or whatever. So the field of pathology is not left behind, right? During this session, we will explore how the genomic sequencing and artificial intelligence has contributed and brought a new era of diagnostic pathology. So as you can see, this is the new era of pathology we are entering into. So earlier in conventional pathology, traditional pathology what you were having is just we will have a slide, we have the microscope and then you check the diagnosis, you make the diagnosis based on morphology mainly, right? But now the NGS, that is next generation sequencing, tells us more about that at the molecular level, which had contributed into giving many insights at the DNA level of the disease, right? So, and in combination with this AI technology and digital pathology, this has revolutionized this, and you can analyze complex databases whose images, now we have the slide, digital images. We can analyze this data with the help of AI. And thus this convergence of the older, that is the morphological basis, along with the molecular data, combined with the AI having, high processing rate, this has, contributed to a shift in the diagnostics pathology. So the foundation which we having is the conventional pathology, where what we needed is the microscope in a slide with a microscope, where you needed basically the pathologist's expertise to have a diagnosis, right? And the main limitation there was that you can have, inter-observer, variation will be there. From one person to another, variation will always be there. And second, the glass slides degrade over the time, so you cannot preserve it. And most importantly, you can't share these physical slides, right? So this was a very difficult thing during the time. And importantly, these days we know that we have got, huge patient load. So it is very difficult and straining for the pathologist to examine so many, glass slides. So it was difficult. So now we have got the digital pathology. So in this, what we have is we have highly digitized, these, what is known as whole slide imaging. So we have digital imaging system which scans whole of the image, and we have got digitized, high resolution digitized image which we can see, and we can examine these under computer, so that we can get do the examination. So digital side, the one thing which is the problem with this is the high cost of the imaging system. So that's one of the drawback of this. So in digital pathology, you have mainly 4 steps. In initial first step, what you do is you have the high resolution scanning. So you have a high resolution scanner which scans whole of the slide. Then you have the image management, because whenever you get those images, you have to store them, which can be analyzed later, and systems organize those archival material we can have, and then remote viewing. So because as we have got those as a soft copies, so you can send them anywhere, so you can report them anywhere from any corner of the world, right? So and then we can have a collaborative work which gives a very good diagnosis at the earliest possible time. Another term, as already Sir touched in the first one, was the precision medicine, right? Precision medicine in earlier times, what we were having is one size fits all. So that means whenever there is a disease, so you have a fixed treatment for that disease, right? But now we are moving from that concept to individualized medicine, or what we say precision medicine, right? This precision medicine is basically we customize the person's treatment according to the genetic makeup and genetic profiling of the particular individual, right? So, and this uses genomics, environment and lifestyle data, so to finally make a decision, so which treatment suits that particular person. This has a particular role in the oncology, because we make a decision for the target treatment based on a particular, what we have got the mutation in the genomic sequence. And 2 technologies, that is NGS, next generation sequencing, and AI, together form the backbone of this, this new diagnostic methodology. So you can see here, so in the precision medicine, you don't have the conventional treatment method. So you have to tailor your treatment according to the patient profile, which depends on the genetic, molecular, and lifestyle data, right? And this has got some advantages, as is effectiveness more and adverse effects are less. So that's why we are moving from that conventional treatment to the precision medicine nowadays, particularly in the pathology, where most of the cancers are driven by different genetic mutations. So this is a very good technique by which we can tailor the treatment for a particular person. So as I told, so new NGS is one of the main pillars for this precision medicine. So NGS tells us something which normally we can't reveal from a microscope. So you cannot get some data from the microscope that we get from the NGS. So NGS basically is a comprehensive analysis of an individual entire genome, so from which we can find out different mutations or variations or copy number changes, which helps us then in seeing what is the problem with the particular gene. So this individually in earlier times, what we are having is, we were having a single gene sequencing, but these days NGS is there because it can sequence a billion number of genes, billions, hundreds and thousands of genes in a single go. So that's why it gives a large amount of data. So you can analyze the data and then find out what will be the problem at the DNA level. So what we have in NGS, what we do is, first is the sample preparation. In histopathology, mostly the samples are basically we get the DNA or RNA from the blocks, right? So that's paraffin embedded tissue blocks mostly we get, and then we have the library construction. So from the DNA you digest that, make small fragments, then ligate them, and then you have the sequencing. Because in sequencing we have got, you can sequence this whole genome, or exomic, or you can have a targeted sequencing. So these are different types of sequencing types. And then because you have a large amount of data in case of NGS, so it is very difficult to analyze it manually, and it will take days together to analyze this. So that is where it comes with bioinformatic analysis. So you have computational methods which predict this very easily for us. And these then combining all these, so we can clinically interpret the data and find out what gene is mutated or what the person problem is at the genetic level, so that that can be addressed. So why NGS? Matters in pathology, that's already I said, because in oncology, the most of the diseases, the cancers are driven by some mutations, right? So, for example, you have the mutation in the EGFR gene, you can have KRAS, you have AKLK, and so many more, right? For example, you have in case of non-small cell lung cancer, it has been found that there is a 40 to 60% increase progression-free survival when it has been treated by NGS-treated treatment compared to the conventional method. So that is how the NGS is useful in treating the patient compared to the conventional methods, right? So this kind of personalized treatment decision powered by NGS improve the patient outcome, number one, reduce the unnecessary toxicity, and optimize the healthcare conditions. So this is another application. You can see HER2 gene mutation. So we can see commonly in the pathology, this is routinely done, that is done for the breast cancer. So if we find at the genetic level it has got HER2 gene mutation, and then we can have this HER2 protein, we have drugs which can inhibit this protein, and that can leads to the inhibition of this tumor growth, and thus the patient survives for a better life. So now the AI. So what is the role of AI in all of this? AI, the game changer in digital pathology. Digital pathology was that is you are scanning this slides and getting information out of that. But what is the role of AI there? So as I told you, we have the whole slide scanning imaging system. So this AI helps us to scan the slide, whole of this slide with accuracy. And sometimes it is more accurate than the person, because a pathologist can exert for more time and he will become bored. Just like sir said that instead of 3 positive he gives 1 positive. So these things can occur, but in AI it will not be done. So it will be more accurate. And with this also the AI detects the changes for you. So it can detect the cancer. So tell you where are the cancerous cells, and also help in the grading of the cancer, right? So this is how this can help us and just predict the prognosis with consistency and speed. So that is what it does for us. It increases the speed, turnaround time is very, very less. So what a manual person can do, it will take a longer time, but in case of AI, it analyzes the data at a very fast speed. So you can have one example where we have FDA approved tool like Page Prostate, where it has been involved in the clinic, in the pathology lab for detecting the prostate cancer and grading of the prostate cancer. So this is already FDA approved there. So AI does not replace pathologists, as already sir said that AI is not going to replace the persons. It is simply guiding you where there is an issue, so it will guide you. Then ultimately you have to take a decision on that, right? So it's not going to replace the persons. So this is what they say. This is digital pathologist assistant. So it can assist you. Artificial intelligence will assist you, but it will not replace you. So it is, for example, it will help you in the highlighting of the suspicious regions. So you have given the slide, it will scan it, and it will tell you these are the suspected regions, and ultimately you have to scan, you can scan for that. Or in case of urgent biopsies, it will just do the pre-screening for urgency. So if it's urgent, so it will pre-screen it, then you can go and see the area which is earmarked. So for biomarkers, like it can tell you the tumor burden in that section, immune infiltration, the cells involved there in the microenvironment of the tissue, as well as proliferation NDCs like Ki67, etc. So based on this, AI will help you in forecasting the treatment, because it has got the whole database. So it tells you based on these morphology or these quantitative biomarkers what will be the possible diagnosis. So this is how it helps in the diagnosis. although AI pathology faces significant challenge, you have to, that's already told that you have to train it. So like for example, sir already told, if you have different regions having some variation, so that can lead to the variation. So you have to train them with different data sets over the time, so they can identify it accurately. So now, how NGS, integration of AI with NGS works, that is precision oncology power couple. So this is NGS AI, that is what is known as the power couple of the pathology. So it helps, this AI helps, because for NGS what you need is a DNA sample, right? So to get a good DNA sample, because to do NGS it takes some time and you have to get it, if the sample is not right, it is going to waste your time. So that is what AI comes into picture. So it analyzes HLD scan slides and gives us the area which are tumor, where the tumor rich regions are there, right? So then you can, not only this, it will also tell you, predict the number of samples you have to process, number of slides you have to process to get the optimum DNA yield, which can be used to go for the NGS purposes, right? So because this ultimately the result what we get from this NGS will be helpful in the getting the molecular data of the patient and result in targeted therapies, because you will find out what is the problem in the genetic level will result in the targeted therapies, faster turnaround time and preserve tissue for future testing. So the key AI technologies which are used at the genomic level, so for example machine learning, deep learning, natural language processes, these are different types of AI, how you train them and how you get information out of them. So already I think sir has told this. So using these technologies, we in histopathology, it analyzes the images at cellular structures to correlate visual features with genetic mutations. So whenever you have the morphological features, then it is correlated with the NGS data, and then from the database it correlates everything and gives you the possible combination what can be the diagnosis of the disease. So this is the advantage of AI. For example, this is an automated, whereas earlier we used to have manual system doing it. Real-time error correction is there. Intelligence annotation systems are C-label analysis pipeline. So basically this is faster, because faster and more accurate if you compare with the human systems. So how NGS and AI work together? So already I told you, NGS generates massive data, because whenever you process so much of, if you have a whole genome, so you have a whole amount of data which is very, very difficult to process. So this is how NGS generates data, and then that data is analyzed through the artificial intelligence system. And then after getting that data, there we have the actionable insight emerge. That means you have the knowledge at the genetic level of the patient, and then you can have the treatment for the patient in an individualized manner. So then you have those team of histopathologists, oncologists, whatever. So they make a decision what will be the best for this particular patient. So this is the workflow I already told you. So you have to take the tissue biopsy, then you have to do NGS, then analyze the mutation which will be present, copy number or whatever, and then have personalized drug selection based on the molecular profile of that patient. So this is one of the case study. So there was a melanoma patient and it was treated by the conventional methods. So on NGS analysis, it was found that it has got a BRAF V600E mutation. So on analyzing this, that it has got this mutation, and from the AI, with the help of AI, they found that from the database, they recommended this BRAF-MEK inhibitor combination therapy. So when this therapy was given to the patient, so the result was patient achieved complete response within 12 weeks. So that is how the NGS and AI work together to increase, the faster. The diagnostic time is very less and you can treat them very well at the genetic level. Other examples, for example, you have another system at AIIMS lab. What they have done, there's a smart path system. What they have done is they have devised this AI system to get the DNA quality, because for NGS you need the DNA. So to improve the DNA quality, they have designed an AI system. So they have designed a system to just get DNA from the HMD slide, so that where from you get the good amount of DNA. So they have designed the system for that, and they have found that there is a 25% more DNA yields within target range when they have used this model compared to the conventional method, where the histopathologists scan the slide and find out this area is good for the DNA purposes. Right, so there is, with the help of AI, it has been found that 25% more DNA can be obtained within the target range. So this is how the AI can benefit in this area as well. So there are more examples like, I already told PACE system for the, diagnosis of the prostate cancer. So this is an AI algorithm for prostate cancer grading as well as metastasis detection. This is already FDA approved. Similarly, Path AI, this has been there in an AI model which is used to assess the drug response in clinical trials. So wherever they are...
So sorry to interrupt, gentle reminder of the timing.
Oh yeah, sure. So similarly, you have other examples. So this is in rare genetics. So this is different from the oncology. So you have different genetic diseases as well, where we can use AI to address this. Spatial pathology, exactly. So this detects the, with the help of AI, you can find out the environment, microenvironment of the tumor. So find out the infiltration of the leukocytes or the PDL, expressing cells, which helps also in later on the therapy of the patient. So basically, convergence, when you combine all the three, that is AI, digital pathology and AI, they can help you in treating the patient at a very fast rate compared to the conventional treatment with better outcome. So challenges I already told, because this involves a high cost. So therefore we have to invest in this for, as we have a big country having more number of cancerous patients, so we can invest in this. Like Ayushman Bharat digital missions, we can have take those as the stepping stones and get an infrastructure for this purpose, so that we can have better diagnostic future. So this is how AI and NGS empower pathologists. So these are how the AI and NGS together can improve the diagnostic pathology. So key takeaways. So I already told that future promises even tighter integration through spatial multiomics. That is because it tells you how the cells are there, how the PDL expressing cells are there. Successful implementation requires robust IT infrastructure, which is lacking in our country this time. Maybe in future we can be better off. Precision medicine guided by multimodal diagnostics is becoming standard of care in oncology. And ongoing challenges include workforce training, that is in the AI technology, we are still lacking ethical considerations, and the future promises even tighter integration through spatial multiomics, real-time AI diagnostics, and federated learning approaches. Thank you for listening.
Thank you, sir. That was so exciting and captivating. We would have loved to hear more, but lack of time, we have to interrupt. I'm sorry for that.
Right.
And it was really nice to hear from you. And as all of us know, this healthcare has been moving in different, advancing in different spheres, and AI plays a role in everything. And the most thing that has to happen is about personalized medicine. That's exactly what we are talking about, because it's no more about generalized pathogenesis. Even the therapeutics have changed. Even nutrition, we have now personalized nutrition is no more prescribing common for all the public. So that was really nice to hear about that, and how AI is going to play a role, because this really requires a genetic profiling for having personalized medicine.
Exactly.
So manually doing it is near to impossible, and so AI really plays a role. And as Sir Ankit sir also stressed, it was nice to I saw in one of the slides you put AI, a digital pathologist assistant. So you want to emphasize that it is not going to replace.
No, it's not going to replace, because it guides us, because the patient load is increasing, so it is very difficult to screen so many slides at a single time.
Yeah.
So it just screens fast and guides you, okay, just check this portion or like that. So it can guide us. So ultimate decision has to be taken by the pathologist only.
Yeah. So that was really nice, and also to wind up your session with real case studies. Thank you so much, sir. The session is open for questions. Yeah.
now slide was there, so I could not read it. That is rare genetic diseases also. It has got a role in every field, but so we tell the field we are interested in. So just like sir was saying, the overall field, so wherever AI plays a role. So AI has got role everywhere. So then you have to find where you fit in.
So with no more questions, and if still you have, you can always approach sir during the
So I will
break.
be there, sir.
Thank you so much, sir.
Right.
A very awe-inspiring talk indeed. You had us also caught up in your presentation. The time just flew. Thank you, sir. I now welcome to the stage Dr. Sumanta Bed. Just a second, that technical problem which we had now, we'll just rectify. On quality management, professional education, and recent regulatory and policy developments in MLS. To share with us about NCHP Act 2021, progress, challenges, key issues, and way forward, I invite the President of Icmls, Dr. Kaptan Singh Sherawat, onto the stage. To accompany him on the stage, I welcome Dr. Pankaj Kaur, Mr. Ramesh Dahal, and Mr. Nilyan Tari. Please join us on the dais, sir. Or Kaptanji, as he is very affectionately called, is the founder and president of Indian Confederation of Medical Laboratory Sciences and is the General Secretary of the Joint Forum of Medical Technologists in India. He is a director of Asia Association of Medical Laboratory Science and also the Icmls delegate to the International Forum of Biomedical Laboratory Science. Dr. Sherawat works at the Kalavati Saran Children's Hospital, New Delhi and leads by example. Welcoming you, sir, as we cede the podium to you.
गुड मॉर्निंग ही चल रहा है ना अभी तो जी सो एनीवे दिस इज ए वेरी इंपॉर्टेंट टॉक एंड NCHP Act key issues progress challenges and way forward. So for that next 2 days, in fact today and tomorrow we'll be discussing more on this issue, very important issue, very connected issue, not scientific and no one is now expert on this issue. We all are trying to interpret the various provision of NCSP Act, implementation status, progress so far about the NCSP Act, its implementation throughout the country. So many issues are there. And on the panel also we have experts from the regulatory bodies, and I'm on the association side, so we'll try to highlight the key issues through this presentation. And remember, this will help you in the next session also. There will be a dedicated session on NCSP Act panel discussion. So a lot of discussions, questions, queries will be there. So this is just a presentation just to sensitize, just to aware you. There are a lot of development, not scientific but professional, which will recognize you as a scientist, as a technologist. Very important issue. And for student as well, this is related to their career pathway, job role, their future prospect. So many things are there. So for professional, for scientists, for faculty, everyone is connected with this issue. This is very important, going to be very important. This may take time, but after 5-10 years, things will change entirely through this legislation. So before discussing anything, let me talk about this Act, NCSP Act. That's a central act passed by the Parliament to regulate and standardize the education, training and practices of allied health professionals, including medical lab professionals. So when we say that this will cover so many things. So if simply you want to understand about this act, this is important for the standardization of profession and professionals. So as far as education is concerned, entire profession is concerned in allied health sciences. This is very important legislative development in the country. So why it is important for us? As I told you, so many things are connected with this: quality of professional education, quality of the professional career pathway, job role. So many things are there. For in every domain, even in the research, clinical laboratory research, we need a clear pathway. In faculty also, there should be a defined career pathway. For the professional, for the quality managers, those who are in industry, those who are in research, so everyone is connected. But efforts were done from as an association from our side. We have, since the enactment of this act, this association with the other important association, National Allied Health, which is representing the ASPs in India, JFMTI, we are trying to sensitize the professional students, leaders, that this is going to be very important, and we should be aware about these legislative challenges or upcoming opportunities. So awareness. Before going to the presentation, let me ask you, because since 2021 we are discussing this issue. Even we had organized a national debate, a national level seminar at New Delhi for the leadership. That was very wonderful discussion. For the entire day we discussed this act, its status, possibilities in future for the student, faculty and professionals. So let me ask you a few questions, whether you are remembering those answers, or you have the knowledge about this legislation or not. So when was the act enacted by the Parliament and notified? Can you answer these basic queries, because this is basic information about the act, whether the students or their faculties are knowing about this or not? Can you give that? So if anyone want to respond to this query, when this act was enacted, just now, just 1 minute back, I referred that year. Anyone from the leadership also? 2021. Yes, on 28 March 2021, the formal notification was done. On 25th May 2021, the first notification related to enactment was that implementation date was decided on that day. So how many categories and professions are to be covered under this act? You can take the mic. So these are important questions, basic questions, not very difficult. 4 साल में we have lot of information on. अब ChatGPT से मत पूछिएगा, Google भी मत करिएगा. यदि आप बताए तो you raise your hand.
It's
Yes.
57, 56 plus 1 new.
यस सर, मॉर्निंग में आपने मुझसे सुन लिया, नहीं तो 56 ही बोलते। मॉर्निंग में सर ने मुझसे पूछा था कि वो अगले 57 कैटेगरी क्या है, तो दिस इज नॉट 56। व्हेन यू रेफर टू द एक्ट, 56 कैटेगरीज आर मेंशन। देयर इज वन मोर कैटेगरी। अभी रिसेंटली गवर्नमेंट ने लास्ट ईयर अमेंडमेंट किया है, पार्लियामेंट में अमेंडमेंट करके उस शेड्यूल में एक्यूपंक्चर प्रोफेशनल जो है उनको भी इसमें ऐड किया अंडर द अदर हेल्थ केयर प्रोफेशनल कैटेगरी। तो नाउ वी हैव 57 कैटेगरीज। I don't know whether on real ground this 57 exists or not, or whether it is a cut paste job, क्योंकि इसका पता you will know when this entire registration process will start. अभी तो हमने cut paste करके 57 बताया, तो if you will ask to these regulatory bodies or regulators, so they will also not be able to give you the number of this, name of this 57. आप किसी health department से पूछिए who are these 57. वो एक्ट से आपको they will tell you going through this act, otherwise they won't be able to tell you the 57. Sometime क्या होता है कि बहुत सारे कट पेस्ट जॉब में बहुत कुछ एक्सपेंड हो जाता है और ये it will take time, but now at present as per law 57 categories are there. This is very interesting. हो सकता है आपके लिए सिलेबस ना हो, पर सिलेबस हमारा भी नहीं है. This is a very important topic, not related to the curriculum. कहीं किसी ने पढ़ा नहीं है डिग्री में कोई, दिस इज नॉट ए पार्ट ऑफ द कोर्स, बट दिस इज गोइंग टू बी रियली वेरी इंपॉर्टेंट थिंग्स टू डिसाइड आवर फ्यूचर इन मेडिकल लाइफ साइंसेज और अलाइड हेल्थ साइंसेज. नेक्स्ट, व्हाट इज द सेंट्रल रेगुलेटरी बॉडी एस्टैब्लिश्ड अंडर दिस एक्ट? सेंट्रल रेगुलेटरी बॉडी. थोड़ा जल्दी करेंगे तो मैं भी स्पीड अप करूंगा, 2 स्पीकर और है, फिर नहीं तो लंच भी डिले होगा आपका. नहीं क्या होगी सर? आप दोबारा से आपसे पूछते हैं, आप ही बता दें.
नेशनल कमीशन फॉर अलाइड हेल्थ प्रोफेशनल्स.
यस, एनसीएचपी के अंदर, एनसीएचपी के लिए एक नेशनल कमीशन फॉर अलाइड एंड हेल्थ केयर प्रोफेशन जो सेंट्रल रेगुलेटरी बॉडी है, उसके अंदर स्टेट की काउंसिल बनेगी. सो दिस इज द नेशनल कमीशन फॉर अलाइड एंड हेल्थ केयर प्रोफेशन. व्हाट मस्ट इज स्टेट यूटी एस्टैब्लिश अंडर दिस एक्ट? स्टेट की काउंसिल होंगी. मैं थोड़ा जल्दी करता हूँ, यदि आप रिप्लाई नहीं करेंगे तो फिर यही हमारा पर्पज, इससे कोई क्वेश्चन आंसर आपका कोई ये, दिस इज जस्ट टू सेंसिटाइज यू, जस्ट टू मेक यू अवेयर दैट आपके स्टेट में होगा क्या इस एक्ट से, एंड व्हाई इट इज सो इम्पोर्टेंट. हम इसको पूरी कॉन्फ्रेंस का ऑलमोस्ट 1/3 पार्ट वी विल बी डिस्कसिंग अबाउट द एनसीएचपी एक्ट, बिकॉज दिस इज द वेरी इंपॉर्टेंट. अगेन एंड अगेन आई एम रिपीटिंग द सेम थिंग दैट दिस इज वेरी इंपॉर्टेंट थिंग टू डिसाइड आवर फ्यूचर. हाउ मेनी स्टेट यूटी हैव कॉन्स्टिट्यूटेड? 4 साल हो गए हैं. कितने सारे स्टेट ने इसको लागू किया है? सेंट्रल एक्ट है, पार्लियामेंट ने पास किया है. कितने स्टेट में अंदाजा लगाइए कुछ, कितने? 50% से भी ज़्यादा जो है स्टेट अभी भी कोई नोटिफिकेशन नहीं हुआ है. ऑल्दो देयर इज नो क्लियर पिक्चर बिकॉज उनके ऑन द बेसिस ऑफ देयर एफिडेविट 50% स्टेट अभी भी इससे दूर हैं, उन्होंने इम्प्लीमेंट नहीं किया है. एंड डिस्पाइट ऑफ हैविंग ए डायरेक्शन फ्रॉम द ऑनरेबल सुप्रीम कोर्ट. What is the difference between rule and regulation? हर कोई कहता है रूल बना दिए, रेगुलेशन बना दिए. बेसिकली हमें मतलब हाउ इजीली वी कैन अंडरस्टैंड व्हाट इज द रूल, व्हाट इज द रेगुलेशन. कोई और जो थोड़ा सा ज़्यादा लेजिस्लेटिव समझ रखता है, रूल्स एंड रेगुलेशंस, हाउ यू विल डिफाइन कि क्या रूल है क्या रेगुलेशन है. रूल्स आर फ्रेम बाय द सेंट्रल गवर्नमेंट. इस एक्ट के अकॉर्डिंग सेंट्रल गवर्नमेंट को रूल बनाने हैं बहुत सारे. Regulations primarily will be defined by the commission with the approval of central government. दोनों का रोल है. How the rules and regulations are approved? किस regulations को approved माना जाए और किस rule को final माना जाए? कैसे final होगा कि ये rule final है और ये implement होगा? तो इसके लिए भी this is the section where they are empowered to frame the regulation and this rules. बट अप्रूवल इज थ्रू द पार्लियामेंट. उसमें क्या होगा कि जैसे अभी फॉर एग्जांपल, आप नेक्स्ट एग्जांपल से आप समझ जाएंगे. अभी एमएलएस करिकुलम डिजाइन हुआ है, उसको नेशनल कमीशन ने रिलीज कर दिया है, बट अगेन देयर इज प्रोसेस इज पेंडिंग that has to be placed before the proceeding in the parliament in next session. Then only it will be approved as a document. So meanwhile they are all uploaded on the website. So this is the process where the central government is also consulted and approval is given by the parliament. every paper has to be laid down before the parliament. So this is the situation right now. Are the distance or online courses valid for registration in present format? Technically no, as per law, but yes, there are provisions. जिसमें specifically कुछ provisions हैं जिसके अंदर commission को करना होगा, otherwise 80% courses were run in the distance mode earlier. So this is the situation right now. We also not 100% sure about anything because these are basically on the basis of our understanding about this act. How can the schedule of the recognized professions be amended? अभी 56 है, 80 कब होंगे या इससे reduce होंगे या how they will be unified और group जो इनका है उसको redefine कैसे हो सकता है? Again that has to be placed before the parliament. That is no state government or central government can decide कि हम तो 20 category हम 56 में हैं. So name if any is to be consulted with the central government and approved by before to be placed before the parliament. So this is the process. ये कानून है देश का, इसमें हम ये बारीकियां समझ में आनी चाहिए कि हम जब कभी इमोशनल होकर डिस्कस करते हैं हमें लगता है सर ये क्या हो रहा है, ऐसा टेक्नीशियन तो कोई होता नहीं है, इसमें लिखा है आप क्या कर रहे हैं. सिंपली द पीपल रेज दिस टाइप ऑफ क्वेरी, दे डोंट नो दिस इज ए लॉन्ग प्रोसेस. हम भी कुछ नहीं कर सकते हैं, वी एज एसोसिएशन जस्ट कैन रेज द इश्यूज. जैसे हमने रेज किया है इशू, वी आर मेडिकल लेबोरेटरी टेक्नोलॉजिस्ट, व्हाट इज द नीड ऑफ सेइंग कि ये हिस्टोपैथोलॉजी टेक्नोलॉजिस्ट है, ब्लड बैंक टेक्नोलॉजिस्ट है, ये मॉलिक्यूलर में है, ये इतने सारे टेक्नोलॉजिस्ट क्या करेंगे आप? हाउ यू विल डिफाइन? Just because that person is posted in a particular department, you are saying that this is the blood bank technician. Our curriculum is common. We are supposed to be called as the entry level medical laboratory technologist and higher level medical laboratory scientist. So why you are classifying so many things and creating a lot of confusion? How they will register in the respective council? But still, these are questions from our side, submission from our side. Let the regulatory bodies to decide how they will amend or reclassify these things. What is the advisory council? And its role, ये problem है हम सबके साथ. Even in the leadership role, we don't know. There is a mechanism to get the approval of a documents. Curriculum बनाया, 3-4 स्टेट से कुछ लोगों को लिया, एक curriculum डिजाइन किया, अप्रूव कर दिया क्योंकि उनको पावर थी. अब वो पार्लियामेंट में रख देंगे, अप्रूव हो जाएगा. When the 50% states are not participating in that exercise, their input is missing, expertise is missing. फेडरल स्ट्रक्चर में आपको पता है कोई भी कानून लागू होता है तो उसके लिए स्टेट का पार्टिसिपेशन जरूरी है. फॉर दैट पर्पस दिस प्रोविजन इज देयर इन द एक्ट, सेंट्रल एक्ट, कि देयर शुड बी एडवाइजरी काउंसिल. व्हाट इज द पर्पस ऑफ दैट एडवाइजरी काउंसिल? टू गिव द इनपुट, टू गिव द सजेशन, सो दैट suggestion from each and every part of the country can be incorporated before taking a decision. Same way, the regulation related to education minimum standard or curriculum require the input from all part of the country. But practicality क्या है कि 50% के पास council नहीं है. How they have approved this, they know. We don't know. So this is the situation right now. This is not anything about against anything. We should be empowered. We should have the proper knowledge so that we can raise this issue before our professional bodies that this is the right process. This is the deviation. Is it valid to take policy decision without advisory council? No, because it undermines the federal participation and procedure legitimacy. What are the penal provision for कोई भी without the defined career schedule, you cannot register in council or commission. So title will be protected. Suppose मेरा registration medical laboratory technologist है, no other person can use this designation in future. Suppose मेरा designation in future medical laboratory scientist है, no other person can use that title. You can refer a one example. In UK, biomedical laboratory scientist is a protected title under HCPC. So no other person can write the biomedical laboratory scientist there in UK or many other countries. So these are the mandate of the law. What are the key implementation gap? What are the key implementation gap as of 2025? Non-formation of state council, missing regulations, unclear registration process, SOPs, weak enforcement. ये challenges हैं अभी इस act में. What the impact on the working professional, मैं थोड़ा स्पीड अप करता हूँ क्योंकि ये डिले हो सकता है सेशन, क्योंकि ये बहुत इंपॉर्टेंट था, इसमें हर बार हमें स्पीड अप करना पड़ता है, जिसके लिए हम इतने एफर्ट्स करते हैं. No formal registration or licensing process in many states. Risk of being considered as unregistered practitioner, limited career progression and recognition. Lot of issues are there for faculty, for student, for working professionals. Unregulated. आप ये भी तो पूछ सकते हैं, what is the need of this council and law? दुनिया भर के कितने सारे लोग हैं जिनके लिए कोई काउंसिल नहीं है. ये तो बहुत इजी क्वेश्चन है, बल्कि ये तो पैनल के लिए होना चाहिए. क्या जरूरी है, क्यों काउंसिल चाहिए, क्यों रेगुलेशन चाहिए? So there are necessities, और वो क्यों जरूरी है? When the public is affected through your decision, through your work, डायरेक्ट पेशेंट सेफ्टी पर रिस्क है, डायरेक्ट पब्लिक पर रिस्क है, डायरेक्ट उनकी सिक्योरिटी, सेफ्टी, हेल्थ का रिस्क है, तब कंट्री में उन प्रोफेशन के लिए प्राइमरी नीड होती है किसी कानून के बनने की. दैट इज utmost important to have a regulators to ensure that, to 100% ensure that yes, there is a legal binding to protect the confidentiality, to privacy, the fundamental right, the health and safety of the public. So that's why this law is important. कितने सारे प्रोफेशन है, we can give lot of example. मीडिया है, there is no regulator. कुछ भी आप वो फंडामेंटल उसमें मैकेनिज्म आते हैं, बट देयर इज नो रेगुलेटरी बॉडी एज सच. एसोसिएशंस आर तो जर्नलिज्म हो गया, एडिटर्स, यूट्यूब क्रिएटर्स, नाउ डेज सोशल मीडिया, दैट इज अगेन अभी तो कुछ ओपन, सब कुछ पब्लिश. तो बहुत सारी इंडस्ट्री अभी भी है जिसमें रेगुलेशंस नहीं है, वो इतना डायरेक्टली इम्पैक्ट नहीं कर रहे हैं, इसलिए चीज़ें वहाँ काउंसिल नहीं चाहिए. हमें क्यों चाहिए? वी आर डीलिंग विद द पेशेंट केयर, डायरेक्ट पेशेंट सेफ्टी एंड रिस्क. रूल्स एंड रेगुलेशंस मैंने बताया कि बहुत सारे एग्जांपल्स हैं, कैसे रूल होंगे, कैसे रेगुलेशंस होंगे. सिंपली यदि आप समझे रूल्स का एग्जांपल, नेशनल कमीशन फॉर अलाइड 2021 में सेंट्रल गवर्नमेंट ने रूल नोटिफाई किए, कमीशन का कंपोजिशन किया, नोटिफिकेशन किया, दोज आर रूल्स रिलेटेड टू नोटिफाइड बाय द गवर्नमेंट ऑफ इंडिया. रेगुलेशंस क्या होंगे? रेगुलेशन जैसे अभी करिकुलम रिलीज हुआ, वो एक काइंड ऑफ रेगुलेशन है, बट दैट हैज टू बी अप्रूव्ड एंड लेड बिफोर द पार्लियामेंट एंड टू बी अप्रूव्ड बाय द पार्लियामेंट. सो दिस इज अ रेगुलेशंस. अभी वो रेगुलेशन कह के डाल रहे हैं, बट दैट इज नॉट 100% अप्रूव्ड. सो दिस इज द सिचुएशन रिलेटेड टू yes. Now this is coming to the second part. This is the situation of the medical laboratory professional in India. 5 to 6 lakhs people are working, और 50 से ज़्यादा छोटी बड़ी एसोसिएशंस हैं इन थ्रू कंट्री. स्टेट लेवल पे सेंट्रल गवर्नमेंट, प्राइवेट एंड हेल्थ केयर लेबोरेटरीज, एवरीवेयर मेडिकल लेबोरेटरी प्रोफेशनल आर वर्किंग. We are part of teaching, training, research, even in public health program, national health care programs, working right from the basic health system to tertiary care institutions of the country, including the research body, research organization, premier research organizations where medical laboratory professionals as a life science professional or as a medical lab professional are working in the research. So our role is very diverse and very comprehensive. Regulatory landscape, yes, in 2021 bill was passed, but that is in process of implementation. Key issues, we are seeking the speedy implementation. For that also filed the public interest litigation, which is under the consideration of Honorable Supreme Court. So the only purpose behind that is to get the implementation done on top priority. So a lot of things are to be, we are anticipating through this law, defining scope of practice, which is very important. Without any scope of practice, what is the use of this registration? Even if you are registered as a qualified professional, your work boundaries is not defined by any law. So then again, a lot of disputes are there. Like somebody can say that you are not supposed to sign these lab reports. You are not supposed to. So this decide by this law that yes, this is your professional boundaries where you can work. Quality and safety, ethics, standard, education, practice, so many things are to be regulated under this. Key issues again we'll highlight tomorrow in other sessions. Quest for regulatory bodies in India, there is a long history. 30, 40, 50 साल से हमारे भी कई जनरेशन पहले के हमारे कलीग, सीनियर कलीग 1976, 1972, 1973 जितने PGI में जो specially because they were qualified, their trainings were advanced and they started long back this training. So this demand was pending since last 3-4 decades from 70s. So, but finally, we also as association started this 15 year back, 20 year back, but yes, now this is a situation, long history of this demand. Basic understanding about rule and regulation and the process, how a law is finally enacted. बहुत लंबा process है. We won't discuss in detail, but yes, basically, first thing is whether it is really required in the society to protect the public. This is the first thing. Government जब agree कर लेती है, yes, this is very important, then they decide to draft a legislation. Legislations में फिर consultation होता है, फिर उसको final draft बनता है, then it is introduced in the parliament. फिर parliament में भी again, if the parliamentary committee, chairperson decide that no, this require further consultation of the stakeholders or public. So they direct the committee that it should be referred to the parliamentary standing committee, then further consultation, and then again come back to that parliament, and this is a way then discussion by the parliamentarian and act is passed and notified. Now where we are, the act has been passed in 2021, rules has been framed partially, regulations are there partially, so we are asking that it should give full implementation of this act, very important. These are few pictures when the act was passed in parliament. I already told you that why it is important. These are the 56 categories, one additional categories of occupational health professionals now added. This is an important document. ये आप समझिए जैसे गीता और कुरान, everywhere this reference document is referred. Unfortunately, this was also referred in our act. और अभी dispute ये हो चला है कि on the basis of this they have divided into 3 categories. और कोई allied health बोलता है, कोई health care बोलता है without any much understanding of this. ISCO is a document basically which was created by the ILO, International Labour Organization in 2008. That's why it is 08. And it is not designed by any national body. This is a global document normally and very advisory kind of things. Not a mandate to follow this document, but most of the countries, those who are part of WHO, they follow the advisory guideline. So on the basis of it, this was included in the National Act and finally divided all categories into 2 separate domains. One is allied healthcare professional, another is healthcare professional. But it created unnecessary issues now. 56 were divided into different domains. So ISCO is a other different issue. I don't want to discuss much in detail, but in 2028 again, the internationally these expert bodies are revising this document. ISCO means International Standardization of Classification of Occupation. So basically this is a kind of classifications of labor work in different domain associated with the job profile. So in 2028 again the ILO is, I think, will publish the next document. I am also one of the part of the international committee which is from the 5 countries. India is also part of that discussion. Hopefully we are submitting through our international federation that it should be revised, and this time we should be classified as a healthcare professional, as a scientist, as a technologist, not as a allied healthcare professional, because in many countries we are healthcare professional, we are dealing directly with the patient here. So this is the reason where at this point of time we are not able to press hard for this, because we don't have any binding, and they are saying that on the basis of this document we have decided this. Allied and healthcare professional, these are the provision under which they decided this. This is the framework of regulatory councils, 10 councils, 57 categories divided into 10 councils. We are on the number 1 council, Medical and Life Science Professional Council. This is a legal framework, structural framework of the law. Lot of things will be there. जो थोड़ा सा भी लीडरशिप रोल में है, they will be part of this framework. यदि आप में 50 जितना हम डिस्कस कर रहे हैं इतना हुआ तो you will be a kind of expert. क्योंकि आज की डेट में कोई एक्सपर्ट है नहीं, तो जितना जिसको पता है, जैसे मैं भी अब बोल रहा हूँ, आप बहुत सोच रहे होंगे मुझे बहुत जानकारी. I also learn from the resources, but यदि आप इतना जानते हैं तो you will be in a position to decide something in your state, because state regulators has also lot of role. किसका रजिस्ट्रेशन करें? You don't know who is the right person, who is the डिस्टेंस के कोर्सेज हैं, रेट्रोस्पेक्टिव क्वालिफिकेशंस हैं, लाखों की संख्या में बच्चे पास आउट हो गए डिप्लोमा डिग्री. उनको अब 1 टाइम कैसे सेट करेंगे, कोई सर्टिफिकेट, कोई डिप्लोमा, कोई 1 ईयर, कोई 2 ईयर, कोई डिग्री 3 ईयर, कोई डिग्री 4 ईयर, कोई मास्टर, कोई डॉक्टरेट में भी कितने स्पेशलाइजेशन, कोई कंबाइंड मिक्सर ऑफ मास्टर कम्युनिटी है जिसमें वो कहते हैं हम तो मास्टर हैं, एमएलएस हैं, मास्टर है, एमएससी एमएलटी हैं, बट पूछोगे कि किसका मास्टर है तो वो शायद उनको नहीं पता होगा। तो ऐसे कुछ होता रहा है 20, 30, 40 साल में। अब उसको कैसे कंसोलिडेट किया जाए, दिस इज अ चैलेंजिंग टास्क। सो these are the important sections which need to be implemented. This is the status regarding, बहुत डिटेल में आप जा नहीं सकते क्योंकि ये सेशन इसको 1 घंटा चाहिए, 20 मिनट वाला सेशन है नहीं ये। फिर भी आई एम ट्राइंग माई बेस्ट कि कुछ आपको आइडिया लगे। और हर टाइम इस सेशन में प्रेशर होता है कि बाकी सेशन ठीक से चल सकें, तो मुझे स्पीड अप भी करना पड़ता है इसको। तो इसमें स्टेट वाइज ये पोजीशन है, ये क्या स्टेटस है, ऑन द बेसिस ऑफ देयर respective state and UTs have submitted affidavit before the Honorable Court, Supreme Court. On the basis of that, we have taken this detail. These are the emerging challenges: regulating and managing more than 50 categories under a single act, regulating different qualifications retrospectively. कितने सारे कोर्सेज, जैसे मैंने कहा, अब उनका रजिस्ट्रेशन होगा कैसे? There might be a lot of questions from their side कि सर मैं कल किसी ने मेरी मीटिंग में पूछा भी था, सर मैं सर्टिफिकेट होल्डर हूँ, उस जमाने में सर्टिफिकेट होते थे, अब मेरा क्या होगा? Lot of questions are there that regulator has to decide how they will establish a system to regulate them. Setting uniformity in educational professionals, setting uniformity in designation RR, setting uniformity in service conditions, setting uniformity in knowledge about the real data with association with profession. इसको के issues है. Final slide. For allied health professional or medical lab professional to be ready to perform a big role in future as a licensed professional with lot of responsibilities and accountability, which require competence, skill and continuous learning. And for policymakers and regulators, AHPs can play an important role in modern healthcare system, each level, which also require a change in mindset of authorities. सबको लगता है ये टेक्नीशियन है, ये क्या इस कमेटी में इसका क्या काम है, इस डिसीजन में इसकी क्या इन्वॉल्वमेंट है। सो रेगुलेटर्स जब थोड़ा फोर्स करेंगे इन्फोर्समेंट के लिए कि नहीं, व्हेन दे आर द एक्चुअल यूजर इन लैब, दे आर द कस्टोडियन ऑफ एवरी काइंड ऑफ सिस्टम, और उसको आप कहते हो उसको बाहर रखते हो। मशीन आपने डिसाइड की, रिजेंट आपने डिसाइड किया, सिस्टम आपने डिसाइड किया, उसको सिर्फ इतना ही काम के लिए रखा गया है। एंड दे शुड आल्सो कंसीडर दैट दे आर प्रोफेशनल, qualified enough to deal with all these technological and legislative policy issues. So they should be part of the policy consultation and all that. And for association and leaders like us, there are a lot of things to do. They have an important role to play in the professional advocacy. Like we are doing our best that yes, lot of challenges are there. And सिर्फ ये नहीं है कि हम raise करें issues को और हम कुछ deal ना करें. We have a lot of role to play. We should find out the solution how we will deal with these challenges. So thank you very much. थोड़ा स्पीड से रहा, कुछ कई जगह स्किप किया. Thank you.
Excellent talk, sir. CHP to give us a complete picture. I now invite Dr. T. Salvia Devi to share her views on the future prospects of medical laboratory science in academic and research. Principal of PEWS College of Paramedical Sciences, affiliated to Srimanta Shankaradevi University of Health Sciences. She has held various responsible posts within the SSUHS framework and has over 12 years of experience in academics, clinical practice and research. Welcome, ma'am. The floor is all yours.
afternoon to all. I should say that it's unfortunate for me or that my session has fallen just before lunch and everyone's mind will be in the dining hall. What menu will be out there and the stomach will be grumbling for everyone. So let me just make it a little bit interesting and I would see if I can give you some takeaway. So I would start off with the line with what Dr. Kaptan Singh has just ended. He has said that we have been sidelined in every aspect. So my topic is entirely related to that. Why we have been sidelined is because the qualification which is required to be in the same platform with the other professionals, whether it is the medical profession or any other profession. So the qualification which is required by our profession, it's lacking in every field. So my topic goes like this: the future prospects of medical laboratory science in academics and research. Let me just start off with a small example with me and myself. That's like I have done my MSc MLT, and I have just undergone a postgraduate diploma in environment and sustainable development. Then I pursued my PhD and I have achieved that as well. And right now I'm holding the position of principal. Just to say a brief about my career with what I have started. It's like I started as a laboratory technician. Then after my laboratory technician profession, I have gone into different other positions of quality control manager. Then I entered into academics in the position of lecturer. Then when goes on and to assistant professor, then associate professor, and then professor. So here I'm not giving my introduction. I would like to say that we need to set an example. We are not supposed to be in just a simple position. We all have to move forward. We all have to go forward. So for that, academics and research is most important. And I think the line has been already highlighted by Assam chairperson, Sir, Dr. I think Pankaj called, sir. So sorry, sir, I have just forgotten. So let me just go forward with this. Okay, I would like to start my talk with a quote that behind every accurate and consistent laboratory result, there is a skilled and expert MLS professional. Then I hope you would have known this and seen this from the series of talks what we have gone through. And from all the expert talks, from the morning session till date, I think all of us, we should accept that we play a vital role within the healthcare delivery system. And the world organizations like the CDC, Center for Disease and Control Prevention, have also highlighted our importance, that is, has appreciated or has focused on the appropriate use of laboratory tests is essential for achieving safe, effective and efficient patient care. And also it has to be marked that 70% of our medical decisions are based on laboratory tests. Both the medical and policy-making communities have acknowledged the significance of laboratory tests. Here I just would like to give one example apart from just reading what all has gone through. Just last year, you can say last month, my brother was just admitted to the hospital just because he was having continuous vomiting for a day or two. So we had to admit him to the hospital, but then as soon as we happened to admit him to the hospital, they had just give some IV fluid and anti-vomiting injections. That was the only thing they did. The next thing what they did was to collect blood for the series of tests. Then his treatment started the next day, where they could diagnose what was the reason behind that. He was suffering from jaundice. So where they found out that there was raised for the jaundice, I think AST, ALT, then GGT, all those levels will be very much high. Along with that, the most concern for the practitioners was that his INR and PT result was also very much high. So they were thinking that might be he is suffering from some chronic liver disease or something. So they started the treatment with the jaundice, but then every alternative days they were conducting the test for almost, you can say, 7 to 10 days. Here what I would like to say is, we are the person who deals or who diagnosed a particular disease or a particular infection. Or apart from that, that's the first thing. The next thing, what do we do? Even the practitioners have given the treatment, we are the person who give them the particular treatment is responding or not. That is the prognosis part, the monitoring of the disease. Right? So this is what I wanted to say, that proudly we should say that we are the one who takes care of the patient. Okay, so based on what I have said, based on the diagnosis, as well as diagnosis of the disease, as well as we are related or we have a major role in monitoring of the disease and prevention of the disease. So indirectly we help in the better development of countries' health outcome and also help in promotion of economic and social development. So there are many programs from the National AIDS Control Program, then revised National Tuberculosis Control Program, then there are other programs of this Integrated Disease Surveillance Program, and all these programs, we are always in the forefront where we help in public health initiatives. Okay, so the role of laboratory scientists are often seen as experts. So in fact, that everyone are aware that we are the experts in machineries and equipments. But it is unfortunate also to say that our role and our hard work has not been, has not been known enough or appreciated enough. Because every time once a patient happens to be admitted to the hospital and when they got released happily, they used to say thank you so much to the practitioners and the nurses. Just because of you all, I could get better and I can leave for home happily. But we, who is the task force, who plays the entire role starting from the diagnosis till monitoring their treatment, we have been you can say neglected. So our importance came into role from the emergence, or you can say from the COVID-19 pandemic. So COVID-19 pandemic, we all are aware that it has given a very bad impact to the entire society, to the entire world, but it has done, I could say, a little bit good thing for allied health professionals as well. So recent advancement, I'm not going to go in depth, as all this recent advancement, whether it is new generation sequencing, which I have already discussed, and also in nanotechnology, digital pathology, allied system, all these things, it helps the disease diagnosis, which will help to reach the greater heights. And also another milestone what we have achieved is the National Commission for Allied and Healthcare Professions, which Kaptan sir have just discussed, where this will lead us as an umbrella body which will help us to frame the legal framework to regulate and standardize the education system, ethical practice and better career development for all the healthcare professionals. So just before starting with the role of academicians, how important is the role of academicians? That is necessary for us to know. So here I would like to say Dr. APJ Abdul Kalam, I think all of us are aware of him, right? So in a particular interview, he was asked by a reporter, sir, with what you would like to remember as. He said, I would like to be as a scientist or else a teacher. So his answer was, I would like to remember as a teacher. Why? Because he thinks that he stated forward that teaching is a noble profession and teachers have the only weapon which we can shape the future generation or the future professionals. So same thing applies for us as well. Academicians play a major role in shaping the future professionals. So standing in this platform, I think it will be wrong if I don't mention Dr. Akshay Chandra Deka sir. I think almost all the people from Assam, I think overall who all are present out here, whether it is students or the faculty members, would have known him or heard about him. So everyone would have accepted if I happens to say that he is the pioneer of MLS profession in Assam, or maybe I can say in the entire Northeast as well. So sir has established many, you can say, MLT departments almost in Assam. That is just giving one or two examples of, as far as I know, Kaziranga University and even Assam Downtown University, sir has established the department. And also recently he has helped in upgrading and regulating the Department of MLS in my same university, that is Srimata Shankardev University of Health Sciences. And also recently sir has established a College of MLT, which is established by himself. So to see that sir is silently building MLS, pillars of MLS, I should say. Okay, coming up to the profession. If you happens to go through, I have just gone through the program schedule, what we have got it today. Out there you would have known that there are so many fields which MLS is involved, whether it is clinical hematology, cytology, histopathology, medical microbiology, genetics, whatever. So in all these things, we play a key role. So it is really challenging to recruit and retain faculties and educators in this particular profession. Why? It's because there are lots of experienced technologists available who have experience of 30 years, 40 years. But the thing is that they don't have the scholarly background for academic tenure and promotion. So academicians in our profession requires in-depth knowledge. They should have known all the advantage and disadvantage, pros and cons in clinical diagnostics, laboratory practices, instrumentations, and as well as the mechanisms, principles, everything, to how to handle the errors, everything, and rules and regulations and framework of the profession, which is a must. So how to go forward, how to build a future generation of laboratory leaders. So there are many steps which we should go through. First is to have a focus goal. Then to have a focus goal, we have to have a continuous education. And along with that, where we should have professional development, we should focus and invest in research and innovations. What are the key areas that we should be focusing on right now? Because the commission is already implemented. So enactment has already started from next year. Officially it was released that we have to follow the commission or council rules and regulations from 2026. So what are the main rules that we have to, priority area where we have to focus? That is, we should have continuous higher education. There should be continuous awareness. Let's say workshops, seminars, conferences, such platforms, such gathering is very important for us, which hardly happens in the area of MLS. And I always say in every seminar or conference or platform that we should bridge the gap between the clinical sector and the academicians. That is, the technologists and the academicians. So, and proudly I can say that Assam has already started in this, that whenever there's any, whether it is National Medical Laboratory Professional Week or World Health Day or World Blood Donation Day, we used to collaborate together and organize some small seminar or workshops. Then along with that, we have to update our knowledge in newer tools and techniques, and also focus research and innovations. So the role of a researcher, before this I just would like to quote one more line, that is, academia provides the foundation of research, while research expands and tests academic knowledge. So it means to say that academics and research goes hand in hand. It cannot be separated, it will go hand in hand. So for MLS professional, we provide precise and accurate laboratory data. That means every day we do research. Because from a person's sample, we have to diagnose what type of disease the person is suffering from. And from the continuous data of that person, we will be highlighting in a particular area, in a particular, in a particular geographical distribution, which disease, which infection is predominant. So everything is based on our data. So what are the new thing what we have to involve in research is we have to involve in developing new diagnostic tools, we have to involve in improving existing tools and techniques, and also advancement in medical sciences, and we should focus on disease control and prevention, also promote and instigate public health, and we should have a deeper knowledge in complex diseases like cancers and genetic disorders.
Ma'am, please conclude.
Just finishing off, sir, finishing off. Okay, so as we are known as a profession without a face, even though we play a crucial role in healthcare sector. What are the challenges? Why we have been called as profession without a face? Because there is lots of gap in technical skills and knowledge. There's a lot of shortage in our profession, and there's lack of adequate laboratory facilities and training institutes, and there's insufficient MLT professionals, and the most important thing is the lack of MLT professionals in higher qualification or higher positions. The future perspectives, we have large demands for educators and researchers in field of MLT, unlimited research and innovations area, as our area of research is very vast, and we are also involved in public and epidemiological research and in collaboration with many research institutions like ICMR, DRDO, CSIR or NIH, and there are many national programs as well. Not only in research and academic area, there is lack of laboratory scientists or clinical technicians. Even in world data, they shows that there will be a higher growth of 13% demand by 2029. And as per data of Ministry of Health and Family Welfare as well, there is a lack of job in entire MLS professionals. So I would like to say that our profession is the most important profession, like what other experts have said. And I would like to end my talk saying that we are the unsung heroes behind the scene on lab coats, the team behind the healthcare that makes the difference. Thank you so much. Thank you.
That was a great presentation. Your talk was particularly interesting. Thank you, ma'am. Thank you, Dr. Pankaj, Dr. Mr. Ramesh Dala, and Mr. Nilyam Tari for staying with us through the session. That brings us to the end of the morning sessions. As we take a much needed break for lunch, a small mention that we'll be reconvening for the afternoon sessions at 2:40 p.m. Happy lunching, everyone.
Chief guest, Dr. Pankaj Kaul sir, and guest of honor, Dr. Subhash Chandra Gupta sir, Dr. Devajit Chaudhary sir, and Mr. Ramesh Dhala, and others dignitaries, Dr. Kaptan Singh, and others faculty member, those who are present in our seminar. And also I want to give the big thanks to our students. They are present, and from the very beginning they are present here and listening the topics in different scientific sessions. My topics, the future of clinical diagnostics in India, its molecular technologies and AI as catalyst. Before going to that specific topics, if we see what is the scenario that has already been told by our Kaptanji sir. Now the clinical diagnostics, it is the backbone of modern healthcare system, no doubt. And there are 56 plus 1 diagnostic specialist, technologist or scientist. They are doing their distinguished role in this healthcare system. If you see the ancient and the future, what is the future? The future of clinical diagnostic in the country promises a shift from traditional hospital-based testing models to a more decentralized, digital and patient-centric ecosystem that already has been implemented in West Bengal, Bhramoman Chikitsalaya, and in ESI, the triple apps by which patient can register and the service will be available from hospital to doorside of the patient. The emerging technologies such as artificial intelligence, machine learning, genomics, POCT and telepathology are redefining diagnostic capabilities, improving accuracy and reducing turnaround times. That is very important. Furthermore, the integration of digital health records, wearable health devices and data analytics is creating opportunities for personalized and predictive diagnostics. That is also very important. With India's healthcare system aiming the universal coverage, better rural outreach, the diagnostic sector is poised to play a critical role in early disease detection, epidemic monitoring, and preventive healthcare. Government initiatives like National Digital Health Mission (NDHM) and the rise of health tech startups are further accelerating this transformation. This is our health community. Once again, welcome to all. In this picture, we'll see the ancient different method of clinical diagnostic method, by which you can see inspection, palpitation, smell, and by which the diagnostic tools were there. That time the clinician or diagnostic specialist or doctors were able to treat the patient. In ancient period of before 1000 CE, what is there? Inspection, palpitation, interrogation, pulse diagnosis, and mol, mutra, jiva, sabda, sparsho, and Greek porikka, and the urine bindu test. In the medieval period, around 1000 to 700 CE, the systematic and clinical observation and basic instrumentation was started. In Nalanda and Tatkasila, the development of an hospital was observed. Urine inspection, manual examination of techniques were refined. Use of lens and microscope were discovered. Early modern period, that is 1700 to 1900 CE, stethoscope, thermometer, microscope, clinical test, X-ray and pathology were additionally attached. The level of 20th century, diagnostic become the laboratory based and imaging based. Laboratory diagnosis with the help of biochemical testing, hematological, microbiological, serological, histopathological. And imaging and instrument diagnostic like X-ray, ultrasound, CT scan, MRI, echocardiography, ECG, EE, EMG, endoscopy, and POCT for glucose, pregnancy, and infectious disease. Lastly, in the 31st century, modern and latest diagnosis, that is biotechnology, genomics, AI, and digital tools. Now the molecular and genetic diagnosis are done by polymerase chain reaction technology, which detect the viral and bacterial DNA, and HIV and COVID-19, tuberculosis, they are also detected. Latest molecular technology like NGS, which detect the genetical disease and cancer profile. Microarray, that is also used for study of gene expression. And one of the best technology, that is CRISPR-based diagnostic for gene editing and gene surgery, genetic surgery. That will two best diagnostic, molecular diagnostic tool, that is NGS and CRISPR-Cas9 technology, by which, and the combination of this molecular technology additionally added by artificial intelligence. Molecular technologies generate huge amount of data. And that data, if we see in Google, Facebook, Instagram, WhatsApp, and whatever multimedia is there, we will be surprised that in our body that data is around 10 times than the total multimedia system data. How? If we see that our body is made up of system, and system is made up of different types of organ. Organ is made up of tissue. Tissue is made up of cell. Cell is made up of different types of cell organelles. I will come to the specifically to the nucleus. Nucleus is made up of nuclear reticulum. Nuclear reticulum, it consists of chromosome. And there are 23 pairs of chromosome in single cell. That chromosome have the double helix structure, which is called DNA. If we take a part of DNA, that is called gene. So this is the last item where we have entered in the genetic material. So in this way, when we introduce in the NGS, next generation gene sequencing, it is the latest technology and highest speed technology. We can, by this NGS, we can find out the DNA sequencing. And that from the DNA sequencing, we will be able to get huge amount of data. And that huge amount of data should be analyzed in our AI with the help of machine learning.
Dr. Mehra, please brief.
Yes. Machine learning. This is the scenario of our modern laboratory system, and this is ultimate future. This is the great tribute to my J.C. Bose, who says laboratories can provide forensic testing, adding criminal investigation and ensuring the justice is served. And this Pasteur, he has told, without laboratories, men of science are soldiers without arms. So this is the final slide, and in which we can This is the medical labs are more than just place where the treats are done. They have become the key spot where the big healthcare decisions are made. One patient has come. We can see that different types of patients, different types of personalities there. When they come, lab have to decide by risk prediction. Then, if according to every disease has their disease signature, the characters, and from that, multi-omics biomarkers like genomics, transcriptomics, proteomics, different types of technology like NGS and CRISPR technology, we will be able to DNA sequencing, and from DNA sequencing will be specifically personalized medicine will be given to that disease. So, risk prediction will identify the high risk patient and targeted intervention, predict disease progression or recurrence, estimate the treatment response and outcomes, detect potential adverse events or complication. Yes, genomics, transcriptomics, proteomics, metabolomics and epigenomics. In cancer research and treatment and early detection, DNA sequencing is very important, where the patient-specific treatment is, personalized treatment is possible, and after that, if treatment is not available, then genetic surgery, by which our CRISPR that is CRISPR-Cas9. It's a excellent molecular tools by which the advanced AI will help and eradication of the genetic disease. Clustered regularly interspace short palindromic repeats, where tools consist of three things. That is guide RNA, Cas9, which is called molecular seizure, and another thing is that faulty gene. The guide RNA will take the Cas9 to the specific genome and edit or delete that faulty genes particles. And that ultimate treat the personalized therapies and disease prediction. So molecular technologies and AI are not merely additive, they are multiplicative catalysts. Together, they are transforming research, medicine, and human understanding at the molecular level, shaping a new era of precision, prediction, and personalized. Thank you.
Thank you, sir.